Begin by inspecting the anterior and inferior surface of the nose. Note any asymmetry or deformity of the nose. Also test for the nasal obstruction by pressing on each ala nasi in turn and asking the patient to breathe in. Obtain the partial view of each nasal vestibule. If the nasal tip is tender, be gentle and manipulate the nose as little as possible. Now for inspecting inside the nares, make sure you use a speculum or larger size. Tilt the patient head back a bit and insert the speculum gently into the vestibule of each nostril, avoiding contact with the sensitive nasal septum. Make sure you hold the otoscope to one side to avoid the patient's chin. Direct the speculum posteriorly and then upward. Palpate for sinus tenderness. Press upon the frontal sinuses from under the bony brows, avoiding pressure on the eyes. Then press upon the maxillary sinuses. For inspecting the neck, note its symmetry and any masses or scars. Look for the enlargements of the parotid or the submandibular glands and note any visible lymph nodes. Palpate the lymph nodes using the pads of your index and the middle finger. Press gently, moving the skin over the underlying tissue in each area. The patient should be relaxed with the neck flexed slightly forward. Feel in sequence for the following nodes: periauricular, posterior auricular, occipital, tonsillar, submandibular, and submental. Superficial cervicals and the posterior cervical. Inspect the trachea for any deviation from its usual midline position, then palpate for any deviation. Place your fingers along one side of the trachea and note the space between it and the sternocleidomastoid. Compare it with the other side. The spaces should be symmetric. Confirm your visual observation by palpating the thyroid gland. First, locate the isthmus usually overlying second, third, and fourth tracheal rings. Now, move behind the patient and place the fingers of your both hands on the patient's neck so that your index finger is just below the cricoid cartilage. Ask the patient to take a sip of water and swallow it. Feel for the thyroid isthmus rising under the finger pads. Let's review the anatomy of the mouth. The lips are the muscular folds that surround the entrance to the mouth. When opened, the gums, gingiva, and the teeth are visible. Note the scallop shape of the gingival margins and the pointed interdental papillae. The gingiva is firmly attached to the teeth and to the maxilla and mandible in which they are seated. A midline mucosal fold called the labial frenulum connects each lip with the gingiva. A shallow gingival sulcus between the gums' thin margin and each tooth is not readily visible. Adjacent to the gingiva is the alveolar mucosa which merges with the labial mucosa of the lip. Tooth anatomy. Each tooth is composed chiefly of dentine, its enamel covered crown, small blood vessels, nerves, pulp canal, pulp chamber. Note that there are 32 adult teeth, conventionally numbered 1 to 16 right to left on the upper jaw and 7 to 32 left to right on the lower jaw. This is the dorsum of the tongue covered with papillae. Under surface of the tongue. Before inspection, make sure if the patient wears dentures, offer a paper towel and ask the patient to remove them. Inspect the lips, observe their color and moisture, and note any lumps, ulcer, cracking, or scaliness. Now look into the patient's mouth and with a good light and the help of a tongue plate, inspect the oral mucosa for the color, ulcers, white patches and the nodules. Also note the color of the gums. Inspect the gum margins and the interdental papillae for the swelling or ulcerations. Now start inspecting the teeth. Are any of them missing, discolored, mishappened or abnormally positioned? To assess the tooth, jaw or the facial pain, palpate the teeth for looseness and the gums with your gloved thumb and index finger. Inspect the color and architecture of the hard palate. As the person says ah or yawns, inspect the soft palate and the uvula. Ask the patient to put out his or her tongue. Inspect the tongue for its symmetry. Note the color and the texture of the dorsum of the tongue. Inspect the entire oral cavity. Ask the patient to protrude the tongue. With your right hand, grasp the tip of the tongue with a square of gaze and gently pull it to the patient's left. Inspect the side of the tongue and then palpate it with your gloved left hand, feeling for any induration.